Medical research and translational medicine have been our family's interest for many decades. In the 1950s, my grandfather met a surgeon from Columbia Presbyterian Hospital. The surgeon had performed a successful operation on my uncle, so my grandfather was very grateful. When the surgeon and my grandfather got to know each other, it became clear that the surgeon was completely devoted to his patients and his research. He cared nothing about money. He cared only about people. The surgeon was my grandfather's inspiration for supporting good people doing good things. Soon my grandfather became active at Columbia Presbyterian, and the first Milstein chair was created in 1962. And that was the start of my family's engagement with medical charities. My father, Paul, and mother, Irma, continued the tradition by supporting the Milstein Hospital building at Columbia Presbyterian, now New York Presbyterian, funding early interferon research, establishing surgical chairs and other vital needed programs. And although my father passed away before it was completed, my mother was the force behind the state-of-the-art Milstein Heart Center at Hadassah Hospital in Jerusalem. My mother was always focused on the human dimension. She loved hearing stories about patients, providers, and good outcomes. My father was a pragmatist. He wanted to know about size, shape, costs, how many people will be served, how many lives can be saved, how many families will come, what research advances can be made. Abby and I are privileged to continue in those footsteps. I like to think that we've been both humanistic and pragmatic with our support for breakthrough research at Weill Cornell, Rockefeller University, the NIH, and New York's Tri-Eye Initiative. My family became involved in Johns Hopkins in 2011 when we funded the Paul and Irma Milstein Center for Senior Health to conduct crucial research on aging and its disabilities. Although both my parents aged with grace, like so many others, saw the ravages that aging can inflict. Therefore, it's fitting that we're working with Johns Hopkins today. You're laying the groundwork for understanding the processes of aging and enabling good health in the last season of life. But going back to my grandfather, as I mentioned before, he was inspired by a particular doctor who crossed his path. Well, Abby and I have been inspired by a particular doctor who has led our efforts at Johns Hopkins, Sean Leng. Sean. As you know, Sean has been in the forefront of discovery related to aging-related immune remodeling, and also leads Hopkins' effort to promote the development of geriatric medicine in China. Related to that, he serves as president of the Milstein Medical Asian American Partnership Foundation, which focuses on the development of senior health care and aging research in Greater Asia. We've been working with Sean for a long time, and it's been a productive partnership. That's why we wanted to expand the partnership by establishing the Paul and Irma Milstein Foundation program at Johns Hopkins on aging and immune remodeling. We did this to honor Sean, to honor my parents, and to honor my grandfather who led the way. Before I close, something else my grandfather taught me. When we support people like Sean Leng, we stand on the shoulders of giants. Sean is one such giant in a room full of giants. And Johns Hopkins is the kind of first-rate institution that is filled with the kinds of selfless people doing selfless work that my grandfather said our family should always support. Abby and I couldn't agree more, and thanks to all of you for what you do for humanity.